Welcome to HealthCast, the heartbeat of health IT. I'm your host, Sarah Seibert. On today's episode, we're joined by Kshemendra Paul, Executive Director of Data Governance and Analytics and Chief Data Officer at the Department of Veterans Affairs. Following the release of its data strategy earlier this year, VA has been using its considerable data repository to improve its services and engage in a continuous learning process that drives the agency's modernization priorities. Paul is spearheading VA's top data priorities that are impacting veterans' healthcare, research in COVID variants, and even collaboration across other federal health agencies. You'll hear why data is what Paul calls VA's superpower.
I came to the VA to be a part of a unique mission, a public trust mission, serving 19.2 million veterans across their lifetimes, starting with their extension on duty at the Department of Defense when they left active service, and then forward with their lives. And it was a really unique opportunity. VA is relatively unique around the federal government in that its mission is retail. VA runs the largest integrated healthcare system in America. So every day, the vast majority of VA employees are on the front line serving veterans in healthcare settings and wellness settings, benefits, memorial affairs. And so that was a really unique opportunity to help VA better leverage data as a strategic asset and lead American wellness, lead American healthcare. So that was the opportunity and what brought me to VA. My role as the Chief Data Officer, I co-chair with partners in the Office of Information and Technology, our CIO shop, our Data Governance Council. That's a diverse, spanning body that has representation from all parts of VA. And within that council, that's a part of VA governance, reports up to the VA Operations Board. We're driving the VA data strategy and its implementation roadmap. So that really is my top priority. The strategy consists of a vision around improving access and outcomes, advocacy and excellence, using data as a strategic asset to serve veterans, delightful experiences, great outcomes, but also lifetime impact, using data from across the myriad touch points, but in an integrated, managed, ethical way to improve the veteran experience and veteran outcomes. The strategy has 5 goals. Things like stewardship or managing data, analytics, technology, workforce, governance, which you'd expect in a data strategy, and a series of 13 mission-facing priority objectives anchored across the operating administrations, across VA. And then that's the mechanism we're using to drive the implementation, right? Focusing on maturing enterprise data management through the capacity and capability building, but tying it to these mission-facing priority objectives.
COVID-19 required federal agencies to quickly pivot to address new demands. VA has leveraged data insights from the pandemic, bolstered virtual services like telehealth, and increased IT capabilities to ensure the agency could continue to protect its patients and staff.
You're right. When the pandemic hit last year, VA oriented on it pretty well and pretty dramatically, not only serving veterans and keeping our workforce safe while we were doing it, as safe as possible, but also activating our 4th mission, which isn't as widely understood and maybe interesting to the listeners of this podcast. We have 3 core missions: healthcare, benefits, memorial affairs, that together serve veterans across their lifetime. But we have a 4th mission, which is to help backstop the American healthcare system in times of national emergency or crisis, like the pandemic, a public health emergency. So, we immediately pivoted to COVID-19 operations. Like the rest of American healthcare, VA has always been a leader in telehealth, telemedicine, and we had a dramatic increase, 1,000 times, in terms of how much connected care we were delivering to our veteran population during the pandemic. Like most federal agencies, the non-frontline workforce started teleworking. I'm actually doing this podcast from home So that was that's actually an interesting aspect of VA because we have such talent across VA, but it's spread out across the country. So we have some experience with remote work, with telework, and we're able to, kind of successfully navigate that. Some people have said, and I have observed it at VA, the pandemic, while tragic, also accelerated the future through the use of technology. And we definitely see that at VA. A couple of interesting things specific to data. So VA has always had investments and capabilities around biosurveillance, natural language processing. And when COVID first emerged, it was a mystery. We didn't understand its clinical markers. Our systems weren't coded to record COVID-19. So we used the natural language processing and biosurveillance capabilities to be able to, for example, mine free text note fields in clinical records, to be able to understand and generate signal that compounded as we learned more, of course, contributing to that learning to the broader community and the federal response, but also integrating that back into our operations serving veterans. The Veterans Health Administration leadership in particular also took a network-wide view. The Veterans Health Administration is made up of a series of 20 plus regional networks across the country, centered on 174 or so medical centers and 1,000 community care centers. And traditional service delivery is done regionally, right, with a degree of coordination. But with COVID, VHA leadership was meeting 1, 2, 3 times a day with network directors, other functional leaders, integrating real-time information, making decisions daily, sometimes hourly, about shifting resources, understanding the effect of the pandemic on traditionally underserved communities, just a variety of really interesting and effective uses of information that did help VA do a pretty good job responding to the pandemic and sharing the learning that we developed with our federal and non-federal partners.
As Paul mentioned, VA increased network capacity and remote access to support virtual care, seeing a 1,000% increase in telehealth and video visits during the pandemic. With emerging variants top of mind, as we approach what many call the next wave of the pandemic, VA will use its lessons learned to prepare for and combat the next public health crisis.
The pandemic has in many ways accelerated the future. VA is no different that way. And indeed, there's been a focus across VA operations, clinical, research, innovation, benefits, information technology, and data to integrate our lessons learned and be able to benefit from those and bring those into our enterprise architecture and our operating DNA. So that's been an ongoing focus of leadership at VA. And specific to data, we're doing a lot to integrate the lessons learned, the Pathfinder initiatives that came up in the emergency response when we pivoted the entire organization to COVID-19, integrating those lessons learned and Pathfinders into the way forward with our VA data strategy and roadmap. So an example of that is the work we've been doing with the electronic health record. That work actually, was happening before the pandemic. It continued during the pandemic. And, Secretary McDonough earlier this year led a strategic review. Acting Deputy Secretary Dr. Carolyn Clancy was the data leader with that. Data was one of 8 tracks, and we demonstrated improved data management and highly reliable semantic interoperability between our legacy Vista platform and Cerner, and building on those lessons learned is discussed in the comprehensive lessons learned report that was published at the end of that strategic review. We're using that as the basis for managing the complexity of operating 2 EHRs during the cutover process and ensuring we have a line of sight on value creation, highly reliable operations using trusted managed data, value creation, and the like. Other examples, I mentioned the one about the natural language processing and biosurveillance. There's further examples around connected care and work to understand the digital divide and how policy choices can help close that gap as a part of the broader administration activity around broadband infrastructure. One investment that was made by VHA during the pandemic was to create a common operating platform, again, to bring together data from a variety of disparate sources, integrate that data, improve and increase confidence in the data through transparent management of it, and then making that data operationally available at the headquarters level, but also at the VISN level, the regional network level, and at the individual facility level to help with decision making in a more aligned way, right? The idea being, let's operate off the same integrated data at a more aggregate level at the headquarters and at a more broken out level as you get down to the facility and things like that. One other thing I would highlight that, we are committed to close and joint operations with the Department of Defense. The electronic health record modernization is an example of that, right? A single EHR following the service member through their journey, their lifetime veterans journey. Key there is joint and federated data management and joint analytics. And under the Joint Executive Committee, co-chaired by the Deputy Secretary at VA and the Undersecretary for Personnel and Readiness at DoD, we've developed are developing and working to finalize a joint data and analytics strategy between the two departments with an implementation plan and recommendations for enhanced data-focused governance across the myriad touch points between the two departments. Particularly excited about that because the veterans journey starts as a service member's journey. So it's critical to have a common framework at every moment that matters along that service member veterans journey to identify the required authoritative data to drive access and outcomes and ensure that data is interoperable, highly reliable, cataloged in a way where it's discoverable appropriately between the agencies, and having the right kind of policy frameworks to share it and do joint analytics to drive aligned policymaking. It's sort of the vision of the Evidence-Based Policymaking Act that created the CDO position that I was hired for two years ago.
Throughout the episode, Paul has mentioned the importance of collaboration, especially when it comes to joint analytics and partnering with other federal agencies to improve data strategies and priorities. Paul will tell us more about VA's joint efforts across the Departments of Defense, Health and Human Services, and more as it rounds out its data strategy and continues to improve veterans' care.
I did talk about the DoD, and we have a number of touch points with the DoD and activities that are sub-organization or program focused around data management. A great example is the firm, right, providing a focal point for operational data management related to EHR between the Defense Health Administration and our agency and the Veterans Health Administration. Key partners, also the work to share core service member separation information at the core information and getting that and using it authoritatively so that we never have to ask a veteran for their paper DD-214, right? That we have the data and it's just a matter of the veteran proving identity to be able to get access to services and benefits at VA. And those are things that are in progress goals that we're working jointly with DoD. But we also work with Health and Human Services and its operating divisions like the Centers for Disease Control, Food and Drug Administration, National Institutes of Health, Centers for Medicare, Medicaid Services, the Office of the National Coordinator for Health IT, Labor, Education, Housing, Agriculture, Justice. I mean, there's touch points with veterans across the federal government. Commerce is a great example with census. And, we use data from the American Community Survey together with other data to help create a premier predictive analytics data set called US Vets has been able to successfully identify almost 1 million more veterans than you'd be able to identify just through administrative data. DoD, through some fires in the 70s, lost a lot of personnel records. And, we've been able to bridge that through the mechanism I just talked about. US Vets is really interesting because then, as a predictive analytics data set, it gives us insight into the entire veteran population. And so we're able to use it as the denominator on a number of studies across VA, about 50 in the mental health, homelessness, suicide prevention, other areas to really help drive research and innovation with, the numerator in those studies being data coming out of our clinical or program activities, and as well using, the data, again, appropriately, the right controls in operational decision support type applications. So, some examples of, and again, this is, I would add here, this was envisioned by the Evidence-Based Policymaking Act, kind of key there. And it was, working with the federal statistical communities, statistical officials, privacy officials, and others, but appropriate and ethical sharing and linking of data across the government to drive greater insight and to drive improved services to citizens. In VA's case, that's veterans.
Looking ahead, Paul explains what we should expect to see from VA as it evolves. He'll explain that data is VA's superpower, and the agency is working to effectively and securely manage and operationalize this data to support its fundamental principles: improve access, advocacy, excellence, and outcomes for the nation's veterans.
Yes. There's ongoing activity around VA as a high reliability organization. High reliability organization is implies a learning organization that is constantly improving, is committed to reducing defects and errors. And that relates closely to more trusted data, highly reliable data that's semantically interoperable across different systems, right? Imagine, in our case, we have Vista, we have, in our clinical case, we have Millennium from Cerner. Millennium is also being implemented by DoD. We have community care. And then we have a variety of benefit systems. We get data from DoD. There's just a lot of legacy systems that generate data. And so the focus on data management and having that data semantically interoperable in a highly reliable way, high data quality, right, then really drives towards foundational support for the high reliability organization ideas. And for example, can help us, contribute towards reducing and improving patient safety and improving insight to drive clinical decision support. And then more broadly, as we look at the data across the myriad programs and touch points and look at that data longitudinally, we have a line of sight. This is a long-term kind of aspirational goal, but we could see where we can start to understand the impact of service and benefits on lifetime outcomes for veterans in areas like health span, economic outcomes, dignity is measured by social connectedness. Right. So, really, as we mature our data management as an enterprise, as we're able to better manage and integrate our data, it gives us an opportunity to really do evidence-based policymaking, evidence-based budgeting to support our veteran populations and ensure that we are efficiently and effectively using the funds entrusted to us by the Congress.
That's all with HealthCast for now. Thanks for tuning in, and if you enjoyed the show, please subscribe with your favorite podcast app or listen to more at governmentciomedia.com. Until next time.
HealthCast is a production of Government CIO Media and Research. For more podcasts, head to governmentciomedia.com/podcasts. HealthCast is produced by Amy Kluber, hosted by Melissa Harris and Adam Patterson. If you liked what you heard, let us know by leaving a review in iTunes or wherever you listen to podcasts. Thanks for listening.